Good evening and thank you for being a part of the Uganda Catholic Television. It's a Thursday, the 20th day of June 2024. I'm Sunday Gloria Aboch with Uctv News, and we are to start with Uganda joining the rest of the world to commemorate World Sickle Cell Day under the theme Shine the Light on Sickle Cell, as medical practitioners are emphasizing the importance of testing as a key preventive measure against sickle cell disease. Dr. Sisi Nalunkuma, a pediatrician at Uganda Martyrs Hospital, Lubaga, along with her team, provides valuable insights into the management of sickle cell disease and its impacts on patients.
Every year on June 19th, Uganda joins the global community in commemorating the World Sickle Cell Day. This day aims to increase public knowledge, raise awareness, and reduce stigma about sickle cell disease, a condition that disproportionately affects babies in Uganda. Despite its prevalence, many cases go undiagnosed due to the lack of deliberate and proactive newborn screening, a crucial element in combating sickle cell disease. Sisi Nalunkuma, a pediatrician at Uganda Martyrs Hospital, Rubaga, emphasizes that sickle cell disease is a non-communicable genetic disorder passed on by both parents.
Sickle cell disease is basically a disease which is inherited from our parents. 99% of the children have inherited this disease from both parents. It's not one, but both parents. And these parents are carriers of the genetic defect, which is sickle cell defect. A few, we shall say about 1%, may be a mutation. A mutation is an accident of nature. We are yet to confirm that because we know there are some children we have tested and the parents are neither carriers. So 99% of the children we have tested have their parents carrying the gene. And I have to emphasize it is both parents.
In Africa, the majority of children with severe sickle cell disease die before the age of 5 due to infections or severe blood loss. Approximately 80% of sickle cell disease cases occur in sub-Saharan Africa, a region burdened by lack of parental or premarital testing.
Globally, we report over 300,000 patients born with sickle cell every year. And 80% of these are in sub-Saharan Africa. In Uganda, the statistics on average report over 20,000 children born with sickle cell annually. And it is parents who have not been diagnosed or who have not been tested who are having children with sickle cell disease. Most of those who have had prior testing, usually before conception or before marriage, are able to make decisions about having children with sickle cell disease. The population, Ugandans, community, as long as you're black, chances are that you may be having the sickle cell gene. Sickle cell is more common in blacks, so it is important that we all test, whether you have had children or not. Reason is because you may have children who are not sicklers who don't have sickle cell, just because they are carriers. But it will help them make lifetime decisions.
The symptoms of sickle cell disease vary among individuals and can change over time. They often include anemia, periodic episodes of extreme pain, known as pain crisis.
The most common one is actually the pains. They will have pains anywhere, in the legs, in the hands, arms, chest, headache, back, abdominal. So the pain can be anywhere. That is the most common presentation. The other presentation is the yellowing of the body. Most of them will come telling you that they have yellow eyes and then probably plus yellow hands, but most of the time to be yellow eyes. The other also common presentation that we are seeing a lot is a child goes to hospital and before they tell you is that the blood is very low. They call it HB in the normal scientific language, but most of the interpretation is the blood is very low. And sometimes they're actually transfusing this child. So you find they're having very commonly transfusion done to them or recurring transfusion. The other one that we also get that may not be the usual is actually stroke. Some of them may just present for the first time and they have like a stroke. You know the features of a stroke. One side is not working, or a hand is not working, the leg is not working, not able to speak, just out of the blue. The other presentation that is also there is common to the males. We call it priapism. They have an erection that is very painful. There may be several of them in a day, but they are long and very painful, especially in the morning for the little boys.
Dr. Nampija Joanita, also a pediatrician at Uganda Martyrs Hospital, Rubaga, highlights the importance of chronic long-term treatment following immediate clinical care for sickle cell patients.
What we do in long term is we give them PenV, and PenV is usually given to those who are less than 5 years, still for the same purpose, protecting them from severe infections. The other one we do is folic acid. Most of you know folic acid that we give to mothers who are pregnant. These individuals also receive folic acid all throughout their lifetime. Folic acid is important for blood formation. On top of that, we encourage good nutrition because they need to have all these nutrients in regards to their health, especially in blood formation. The other thing that we also encourage is vaccination. Yes, they will receive vaccination, routine vaccination when they are babies, throughout their infancy to their childhood, but there are special vaccines that we promote that they should get. And one of them is actually the pneumococcal vaccines, the pneumococcal 13 and pneumococcal 23. Those are not provided by the government of Uganda. We usually encourage that they actually are able to buy them and get them themselves. However, government has been very kind, is able to give them the other routine vaccines as any other child. With the vaccines, after the vaccines, we also encourage that they get what we call malaria prophylaxis. Dr. Sisi talks about that malaria gives them very severe symptoms, so we need to protect them from malaria. So their lifestyle, obviously, one of the most important things is routine clinical care. They need to check into the clinic and they're given advice. Even if they are well, we actually encourage them to come and see the doctor and keep their appointments. That's one of them. The other one is nutrition. Nutrition, they need to have a good, balanced diet. You know what a balanced diet is made of. All the foods have to be part of the menu because they are very important for growing, for making that blood, for develop. Everything is important in that balanced dieting. The other one is fluid intake. A normal person may take about 2 to 3 liters a day, but we encourage that a person with sickle cell disease should be able to take at least 1.5 times the liters the normal person takes. The ultimate way of managing and preventing this condition, it comes all the way from pre-marital testing. Pre-marital testing, before you actually come together and have a child, at least let's know our sickle cell status, as we know our HIV status.
The Deputy Principal Nursing Officer at Uganda Martyrs Hospital, Rubaga, Nakayisa Lilian Insubuga, underscores the importance of early testing. She mentions the Ministry of Health program that enables testing for children under 2 years of age and urges mothers to ensure their newborns are screened for sickle cell disease.
With us, Uganda Martyrs Hospital, Rubaga, we are a private, not-for-profit. Our patients come here. They pay for the services they receive, though the charges are subsidized according to the Catholic Church that takes us. So we give services. We have a 24-hour emergency service delivery. Anytime a patient comes in, they get the service accordingly. The staff are fully trained and we get ongoing refreshments regarding refreshing our knowledge and ideas in managing sickle cell. So the team is really very good. We appreciate that. So any moment one comes in, they are ready to receive a service. We also have a 24-hour laboratory service. Laboratory services are very key in managing of sickle cell because the tests you've heard about, they go through the laboratory. So that team is also there 24/7 to take charge of that responsibility.
Nagawa Sheila, a 30-year-old sickle cell patient, shares her personal challenges and how she manages her condition. Reflecting on her experience, she voices the need for more comprehensive support and awareness for individuals living with the sickle cell disease.
Okusomoza kwetusanga nga tukola nga tugeze ku mirimu oba nga ogenda funa omusajja n'omugamba nti olina sickle cells ng'akulekawo ng'agenda ne ku mirimu wofuna attack like emirundi ng'esatu mu week oba omwezi bw'oso nga atandika okugamba ngenda kusalako omusaala ngenda kugoba ku mulimu kwegamba n'obeeraawo noweeremererwa gwe kennyini noga ngenda kukola ki nobeeraawo n'onakuwala. I take care of myself, nkola exercise zosi za maanyi nnyo, ndya bulungi, nfuba okulaba nga neewala stress esinga otuleetera attack okutuuka mu crisis, mira bulungi eddagala lyange.
While significant efforts are being made to address the sickle cell disease in Uganda, more proactive measures, including widespread newborn screening and increased public awareness, are essential in reducing the burden of the disease. Nora Osende for Uctv News.
And now, the Association of Catholic Educational Institutions in Uganda has announced plans to implement the Uganda Catholic Education Management System. This initiative, revealed by Father Okello Ronald Reagan, the Executive Secretary for Education at the Uganda Episcopal Conference, aims to unify school management across the 19 dioceses. The new system will enhance efficiency and harmony in academics, finances, human resources, administration, procurement, and school fees management within Catholic educational institutions.
Following the annual conference of the Association of Catholic Educational Institutions held in April, where all educational institutions under the Catholic Church gathered to discuss bridging gaps in skills and values in education under the theme Addressing the Gaps in Skills and Values in Education, Our Responsibility. Today, Father Okello Ronald Reagan, the Executive Secretary of Education at the Uganda Episcopal Conference, says plans to develop the Uganda Catholic Education Management Systems are underway. The system aims to unify school management across the 19 dioceses, covering aspects such as academics, finances, human resources, administration, procurement, and school fees management. The goal is to enhance efficiency and harmony in school operations.
But most especially is to see to it that the resources we have in the school, both human and financial resources, and the infrastructure and other inventories within the school are properly kept and properly managed by all the stakeholders. That will also help us to know how many students we have in our Catholic schools. Will also help us to know how many teachers we have in our Catholic schools. Will also help us to know how generally administration is being managed. How many times do the board meet? Do they really meet? Do the school management committee members meet? And if they meet, are resolutions followed? And so forth and so forth. This will help us to also track on the kind of education we are offering to the students and the pupils in our schools. Are they of quality? What areas do we need to improve? And where are we weak or where are we strong that we need to strengthen?
Effective information management is crucial for organizations as it ensures knowledge preservation, allowing valuable insights and data to be systematically captured and stored, thus preventing the loss of critical information. Additionally, having access to accurate customer information enables personalized and efficient customer service, significantly enhancing customer satisfaction and loyalty.
There's going to be improvement in the way we administer our schools, because there's a component that tackle administration. We'll be able to know what actually is happening within the school. We'll also be able to know how our finances are being managed. Are kids paying school fees? Are budgets being followed? And then also in terms of procurement and logistics, also be able to track from what has been budgeted against what has been spent. So it's going to bring along administrative issues will be streamlined. Financial issues also will be sorted out, academic issues. So definitely it's going to be an improvement. And this we expect will also improve educational performance. Things that are happening within the classrooms and things that are happening outside the classroom.
Following the annual conference of the Association of Catholic Educational Institutions held in April, Joseph Nzukwa, the chairperson of the Association of Catholic Educational Institutions under the Episcopal Conference, highlighted several key ideas tabled during the event, including the unification of all Catholic institutions. This initiative aims to enhance collaboration and standardization across the institutions, fostering more cohesive and efficient education environment.
Is about uniting all Catholic institutions for a common good, and which is the learner in the institutions that we handle, right away from primary up to universities. Our core idea is to improve partnership and networking of all institutions to ensure that we focus on quality education for our learners and to support the government to deliver education services as we have always done as a church or the Catholic Church.
Strengthening the values of children is crucial for holistic education in Uganda. A comprehensive approach that incorporates values can lead to the development of a well-rounded individual who is not only knowledgeable but also ethical, empathetic, and socially responsible. By emphasizing values such as honesty, respect, compassion, and civic duty alongside academic learning, Catholic schools contribute to the broader goal of nurturing capable citizens who contribute positively to society.
Once values are attained, know that other skills will be got. But what we are realizing is that our society looks at more on the skills without values. And the reason we all ask ourselves, what is happening with our education? One completes school with a profession, yes, but then finds challenges at work because of the gap in the values. So our first conference was basically to look at where is the gap, and so what can we do as head teachers? What can we do as heads of institutions so that we address that gap? We ask people to learn from the Catholic Church approach, to join these institutions, because even when your child is not a Catholic, will see that good value and copy it, and therefore make that person a responsible person. So the idea of education is about building a child, a holistic child. So that's why the church is stronger. That's why Catholic institutions emphasize more on values.
The Association of Catholic Educational Institutions aims at unifying school management across 19 dioceses. Such comprehensive efforts underscores the importance of effective information management in preserving knowledge and ensuring personalized service delivery, critical for fostering ethical and socially responsible individuals in Ugandan society. Nora Osende for UCTV News.
Kampala City traders under their umbrella body, Federation of Uganda Traders Association FUTA, have announced a countrywide closure of their shops starting July 15th, 2024 in protest over government's taxation policies. The decision was adopted during a traders leaders meeting held at Express Hotel in Kampala earlier today.
On 7th May of 2024, His Excellency Yoweri Kaguta Museveni met with the traders at Kololo Ceremonial Grounds with an aim of addressing the business community grievances, which included the controversial electronic fiscal receipting and invoicing solution, IFRIS, among others, though the meeting yielded no substantial results, and the President offered to meet them again on the 20th of this month, which is today. Last Friday, leaders of the business community were invited at State House in Entebbe, and upon an engagement with the President, resolved to push the meeting to 31st of next month, as suggested by the President.
Nawe jogenda okutwala tusazeewo minutes zigambye tugenda kutambula Uganda yonna nga tugamba abantu ennaku z'omwezi 15 tukola tutya tukulawo ddi ng'ensonga zaffe zikoleddwako ifreezing evuddewo ipoti tutengese emisolo gyonna nga gikoze gitya
tugenda kwekalakaasa kubanga olulimi lwawulira tugenda kwekalakaasa tugomba kwekalakasa ate mu bukambwe ennyo twe tunaalaba nga ye atulemereddwa buli kimu tujja kukyogera buli lulimi tujja twogera.
Earlier today, the traders leaders who subscribed to FUTA convened at Express Hotel in Kampala and resolved to snap the Entebbe resolution.
Tugenda kukolera wamu mobilization mu Uganda yonna. Tugenda kutambula. Oba munaatuwa mmotoka emu oba zinaaba mmeka. Nga bw'olaba Bobi Wine bw'atambula. Tugende Masaka tukubeyo meeting yemu bweti. Tugende Mbalala tukubeyo meeting yemu bweti. Tugende Gulu tukubeyo meeting yemu bweti. Tugende Mbale tukubeyo meeting yemu bweti. Tetugenda kulya wadde okunywa twetoola bwetooloozi tukomawo wano e Kampala ng'enkera tuggalawo maki maduuka. Tuleme kukikolera wano Nabugabo Bendi Kiwanuka Energy Center and what have you. Tukikole Uganda yonna ne gavumenti erabe nti abasajja ekituufu bali mu kukunga.
Godfrey Katongole, the chairperson of CATA, revealed their plan to initiate mobilization drives in order to compel all traders across the country to close their businesses, starting by 15th of July this year.
Ono mwami tawulira bigambo bya kuteesa era bwe tunagamba bannaye ssebo era ssebo tusobola n'okumala emyaka 8 naye bwe tukola kye tukola ye kennyini ajja tuyitanga ne meeting tenatuuka.
Bwe tuba twagala nga full figure bayagala President Museveni amufuna bakola bwe baagala President Museveni bamukola ki bamufuna. Lwaki ffe abasuubuzi bwe baagala tutuukirize ebikolwa byabwe ebya ifirizi n'ekirala ate ffe tetubikola ki tetumufuna.
The traders reasoned that President Museveni has consistently not been convinced by peaceful dialogues, but only gives attention to protests.
Echa president about industrialization echondabanga mu butuufu tekisoboka kati sente tuzijjawa ze tugenda okuteeka mu industrialization ekirala ne tuba tugenda kikola atutwale mu process nti tukiwe time frame tugambe nti mu myaka 10 kino kye twagala okukola ki okutuukako twetaaga capital bwe tugenda okuteeka mu industries ate tetwagala byabwereere bumuteekewo obubiina bwali bukoleddaani.
The president's gospel has always been convincing the business community to adopt industrialization over importing commodities, and this has always been accompanied by overtaxation of the imported commodities that can be able to be manufactured in Uganda. And to this, the traders responded.
Tetunaba kutuuka kussa litugaana kusaka bweru. Chairman waffe owa CATA Mwami Katongole omukama bw'atuyamba n'oddayo ew'omukulu ono mugambe ensi yaffe weeyimiridde tennaba kutuuka kussa litugaana litusobozesa butasaka bweru kubanga ebintu byonna bye bakozesa wano tetulinaako kyaffe kiri wano kye tukozesa.
Joseph Kabale, UCTV.
Caritas Uganda, in conjunction with the Uganda Farmers Common Voice platform, have organized a food safety dialogue to address food supply chain and food value chains in Uganda. The event brought together members of farmer associations and cooperatives from various regions of Uganda. Take a look.
Farming is a job and it must be treated as a job, both for food security, nutrition, and also for income. Unfortunately, in Uganda, farming has been not respected by the farmers themselves, by the traders and middlemen, but also by consumers of food, and yet all of us survive on food. So we are so challenged as a Caritas or as a church to see our food now not respected, and also to see that the farmers themselves are not respected. So when you go to the markets, when you go to the farms, actually, you will still find people using bad chemicals to kill pesticides on their crops. And these bad chemicals come through our channels, our markets, and they go to the farmers. Also, we find that when the farmers have harvested this food, they also don't take care of it very well. The dried food is dried on the roads on which we are supposed to be driving vehicles or motorcycles. In some places, motorcycles and pedestrians just drive on grain of maize and beans, and so without any remorse. And the fumes from the vehicles, the fumes and whatever is on the ground just comes onto the food, which we end up eating.
Let's look at standards, because people are not in this ecosystem. Still think standard is such a sophisticated thing, but it's just a document that provides requirements, even specifications or guidelines or characteristics that can be consistently used to ensure that the materials or products or processes or services are fit for that purpose. So it's basically some information to guide on what you need to do to produce a product, a service of a particular description. Isn't it? So we are not going to look for a standard into a scientific world. It's just as simple as that. The how to do. Isn't it? The standard will talk about the how to do. We need standards, and one of the justification is that they provide a common language to measure and evaluate performance. It's very difficult to compare between the practices of two people to know who is doing it right. Once we have one document that gives a prescription that has been tested, then it helps to standardize the processes.
We are suffering a lot in this country due to the problem, food safety issues, especially in regional trade. We have had a lot of interceptions. Even recently in South Sudan, we had our maize rejected due to food safety issues. Because food safety, for regional trade, our key issue for quality is food safety. And the region is a key destination for our exports. Because in the region, people may not so much bother on the color of the bean, of the color of the maize, but nobody is going to be ready to import and sell food and poison his country. You can see even a younger country like Sudan recently rejected our maize because it is protecting its population. Because if people are protecting the population, that means even likewise here in Uganda, we have a responsibility to protect ourselves from the problems of unsafe food. And I would like our people to understand that there is a relationship between the consumption of unsafe food and the prevalence of now some of these terrible diseases, like cancer of the liver, and many other cancers. There is a great relationship between consuming unsafe food and the prevalence of cancer.
And that's it from the local scene. Let's take a look at today in history. We do appreciate your company here on UCTV News. We are going to take a break and we'll be back shortly.
UCTV, good news for all.
Catch incredible stories of resilience, success.
You can manage dirty money
with a topping of inspiration.
Get interested in people, not interested in yourself.
Inspire, achieve, repeat.
You are watching UCTV, good news for all. For this and more, tune into Kasese Get Radio 100.5 in Western Region, located at the hill of the Diocese of Kasese. KGR brings you all Catholic programs and an advertising platform in all our radio shows like Good Morning Renzori, Chama Toboka, Ukute, the business show, Propeller, the request show and sports, Evaluation, Bahinga Bakuluka, Late Night Show, and many others. Our other services include Isuzu Tipa, a no car, public address system, live band, Omokekera, an audio recording studio, and outside live broadcast. For more information, call 0773 597 166 or visit our website www.kasesegatradio.com. Kasese Radio, Omusondoria, the voice of truth.
UCTV, good news for all.
And with the Rome Reports segment closes our Thursday edition of UCTV News. I'm Sunday Gloria Aboch. Good evening and good night.